That can be a bit of a fine line, because if the tooth is going to be hard to fix to begin with, and it's going to cause a problem, you're looking at it, and even if you try to do, a restoration on it, it might abscess anyway because the decay is already deep.
Because I think that one of the problem with us is that you cannot second guess yourself, right? Like, okay, am I seeing what I'm seeing, or am I just imagining things?
End up coming to us because they never came to us before anyway, except for to bring these two children who they brought in. And then we saw that the one was definitely being abused, and then the other one said he had witnessed the abuse.
Welcome everybody to Real Talk Real the Dental Chair. I'm your host, Ima Steffi, and today we are diving into a really important topic, the role of dental professionals in recognizing and reporting abuse and neglect. And we have a very well-known guest among our community to discuss this important topic, Dr. Alessandro, who is going to help us understand this better, what to look for, how to handle it, and why it matters. Thank you so much for being here, Doctor.
Thank you so much for having me. I appreciate it, Inma.
Of course. Doctor, can you explain what constitutes neglect and abuse? Just the definitions so people have that clear.
So, for example, neglect is when any part of the body health-wise is not attended to, so medically or dentally. So if you don't bring somebody in, for example, if a parent doesn't bring a child in for medical visits, that could be considered neglect. And the same thing for dental visits. I mean, if a parent doesn't bring a child in for dental visits and then decay or disease happens, that can be considered neglect, especially if it's not attended to, addressed, taken care of, and then problems, complications arise after that. So that's certainly neglect. Abuse can be a whole bunch of different things. It could be physical abuse, hitting, burning, all sorts of things. And you can see signs of that physically on a person's body unless they're concealed. It could be mental abuse. It could be, there can be intimidation. There can be things along those lines. And that can be harder to recognize because there's no physical sign of it. A person can just come in, and if they don't really show signs of any kind of distress or don't mention anything, you may not detect it at all. So there are differences between the two. And sometimes it can be very hard to recognize, especially the more, the mental abuse type of thing. The physical abuse, again, that's visible. There are signs that you can see. I mean, you can see bruising, scarring, you could see burns, cuts, all sorts of things along those lines. And then, the mental abuse type of thing, though, is harder to detect because somebody doesn't have any outward signs typically. They might have certain facial expressions or the way they present themselves, which might make you wonder if, they're okay or not that day. But you might think, well, maybe they're having just a bad day, and that's that, and not necessarily that they may be, again, being mentally abused or somehow told not to say things or not to express themselves. And so that can be a lot harder to detect.
Dental professionals are mandatory reporters, right?
Yeah,
And there
they
is
are.
some people that didn't know that. And I discovered this during one of your posts that they were.
So yes, we are mandatory reporters. Dental professionals are your dental hygienists, dental assistants, the front desk folks. Basically, anybody who's in dental is a mandated reporter.
So why do you think that dentistry is such a key field in recognizing signs of abuse and neglect?
Well, we're in a position to see, well, especially when it comes to neglect. I mean, we're looking at people's mouths, and if we see that they come back over and over again and they don't have any treatment done, and that's neglect. I mean, and there's obvious problems. That's very clearly neglect, and you need to address that and take care of the problems before they can become pain and swelling, before they can become infections that not only are in the mouth but then spread to other parts of the body. So dental neglect is very easy to see and detect. Now, as far as physical is concerned, it can be a little bit harder, especially if maybe somebody has marks on their bodies but they're covered by clothing, and so you might be able to see them if they're wearing short sleeves or shorts or things like that, and you can see scars, you can see, bruises or cuts or burns, like I said, things along those lines. But even then, I mean, when you're talking about kids, they do all sorts of, they're rough and tumble. They'll run all over the place, fall. And so it can be harder to really tell with kids because they're playing hard and they're having fun. And even if they bump themselves, it might hurt for a second, but then they lose track of that because they want to go and have more fun. So they just go do their thing. And so you see all these bruises. I mean, it could be they're playing with their friends or their siblings or something, and they just kind of beat themselves up that way. And it's nothing abnormal. They're just playing.
It is very hard. I remember when my daughter was little, and she was a little bit of a tomboyish, so the doctor, when I went for, I think it was a vaccine or something, asked him, questioning me,
Yeah, well, yeah,
"Why does she
right.
have so many bruises?" And I'm like, I take her to the park every
Yeah,
day. She
right.
she plays.
Yeah. So yes, and that could definitely be the case.
So it's difficult. It really is difficult. But I think that we are in a very good position because we spend so much time with the patient. And one of the things that we were teaching in a school is to look at the patient from, everything that we can see
Mhm.
and document.
Right. Yes. That's very important to do. If you're seeing signs that might be neglect or abuse, it is important to put that in the chart. But you can always ask the patient. They may or may not answer. So, I mean, they may or they may say no, I mean everything's fine, but there actually is something going on. It can be a little bit tough to get out of a patient. Now, I've never faced quite that situation, but knowing other people who have, sometimes the answers don't come out right away.
And I think that also the person that is abused
Mhm.
can feel, they can hide it pretty well
Yeah,
because
they got it.
they can feel guilty. They feel that it's their fault, that this
Yeah.
is happening, that they deserve it. There is a sense of shame. So it's very difficult. But what are the most common warning signs that you have seen in the dental chair that could indicate abuse?
Well, personally, the case that I saw is more of a neglect one. But
Mhm.
my practice partner, when he was still practicing, did report a case of abuse where the actual child, who was an Amish child, reported that he was getting beat at home by his father, in this case, and had bruises and marks on his body from being hit with a belt, things along those lines, and they were very clearly visible. So in this case, we were looking at visible signs, bruises, marks, things along those lines that you couldn't really hide. I mean, they were in a number of different spots. So you're looking for that. You're looking for maybe cuts, for burns. Sometimes it's cigarette burns or things along those lines. I'm sure there's possibly scalding water, depending on the case. It's a whole bunch of different things, but there should be a bunch of marks, and it could be in places it's hard to explain. Like it's hard. Oh, how did you get that there? That's kind of a strange spot to get hit or get something. Right.
Right. So how can we differentiate between accidental injuries and something that raises suspicious?
You can question a parent, and just like I think your physician questioned you a little bit about when your daughter had all sorts of bruises and she was a tomboy running around and playing. You can question the parent. Now, I mean, if the story kind of makes sense, okay, that's fine. But sometimes the story doesn't quite make sense. So if you document it and then you document, oh, this was the story from the parent, and it just doesn't seem like two and two are being put together. Okay, yeah, that can raise some red flags.
I think that one of the most common red flag would be fell down the stairs or something.
Right, weird stories that don't make sense.
What are the red flags that should a hygienist or a dentist be aware of for neglect?
And if you're looking at neglect, you look at, for example, you can look at their hair. You can look at other signs, like are they dirty? Does it make sense? Like they're really dirty, but they're not people who are typically outdoors or doing things. Their clothing can be disheveled and can be torn, or not look like it's right. Smell could be a part of it. There are a number of different things. But yeah, I mean, just outward appearance, like things just don't look like they're well kept. It can be a little bit rough. Now, it's a little tougher for me in my area because I'm in what I would call an agricultural community. I mean, these kids are running around outside all the time. You have your 10, 11, 12-year-olds who are out milking cows in the morning. That's what goes on in our area. So, and yeah, you're covered in dirt. Yeah, you're covered in mud. Okay. I mean, they're farmers. They're going to be out there. They're going to be doing stuff like that. I can't call that neglect. That's just part of what they do every day.
Right.
Right.
Exactly.
Yeah.
So you think that, let's say that you have a patient and it's a child and the father doesn't want to fix the tooth, a baby tooth
Okay.
that the patient is going to have for a long time, for many more years to come, and wanted to pull it out just because it's the baby tooth.
Okay.
What do you think about
So that can be a bit of a fine line because if the tooth is going to be hard to fix to begin with and it's going to cause a problem, you're looking at it and even if you try to do, a restoration on it, it might abscess anyway because the decay is already deep. You might say, well, it's better to do that than to let it just go and not have anything happen. And then they show up with an abscess, and then there's pain and swelling. So that's a tougher gray area. It's not neglect. I mean, they're bringing the child in. You could say for care. It might not be the care that you necessarily want to give. It might not be the ideal treatment, but if it's going to keep the child out of pain and suffering and problems, maybe that's going to be the way it's supposed to be just for that time.
Yeah. What if the kid has several cavities, like maybe like 5 teeth, and the cavities are not huge, but the father says, they're baby teeth. I don't want to spend the money on that. Just pull them out. What do you think about that?
That's tougher. Now, that's a case where you can say, well, you can always dismiss the patient because it's like, I don't agree with this type of treatment. These are fixable teeth. They should be fixed. And, my recommendation is to fix the teeth. And if you can't fix them, if you don't want to fix them, then I may have to say you need to find another office to take care of your needs. So that's an option for you. Now, whenever you do that, if you're dismissing a patient, always make sure that you write a letter, send it certified, and say, okay, you have in 30 days to be seen at our office for emergencies where you have that availability. But after that time, you need to find another office. So you need to make sure that you cover your bases with all of that. Yeah.
I had a case like that, and I actually talked to the father about it, but it was no talking.
Yeah, I understand. No, no, I understand that.
I talked to my doctor about it, discussed it, and, you know,
Yeah. Sometimes that's all you can do.
it's all you can do, yeah. So, if a hygienist or dentist suspect abuse, what would be the very first steps that they will take?
So it depends on, I mean, every state might be a little bit different with what they do. For example, in Pennsylvania, and I pulled it out on my video, it was Childline. That was the number to call. There was a 1-800 number to call. There's also a website. Pennsylvania has a specific website. And so you can contact, the child abuse and neglect authorities, through PS. And that way, they can start to get involved. You want to document in the record. You want to make sure that that's written in the record that what you've observed, what's going on, and then the fact that you contacted that agency to get the ball rolling.
I think that every state has an agency or something that you can call.
Yep.
Yeah, and I think that I was surprised to hear that some of our colleagues did not know about this because this was
Yeah.
something that I learned in a school.
Yeah. We learned in school. I mean, we have every year we have to do child abuse and neglect. There's CE that's mandatory, so you have to do it at least certainly in Pennsylvania. We go through training for our license every 2 years, and so we have to do CE specifically related to that. I mean, yeah, I'm not sure about how other states manage it, but I'm kind of surprised if somebody doesn't know about it and they're
I
indebted.
I was a little surprised too. That's why I thought that it was very important. I to kind of get it out there because
Thank
that kind of raised the flags that there was people that actually didn't know.
Yeah.
So
Well,
I
yeah, that's good.
thought that it was worth talking about it so they are informed that they do have that responsibility actually to do so.
Yeah. And it is very important because,
Yeah.
in this case, in many cases, it's child. Sometimes it's adults, but in many cases, it's a child. They can't speak up for themselves, and so it is really critically important to get them the help that they need because that's the entire purpose of it is getting them the help that they need.
We have to look at everybody the same because, especially when it comes to abuse, because we are under the impression that the abused people are only children, women, and things like that. But that is not always true.
That's not true. Yeah.
No,
No.
elderly, but there is some men
Yeah.
that actually abused by women, by their
Yes.
spouses.
Right. So it might not be common. In fact, it's pretty rare, but yes, that does happen. I haven't seen any, I haven't personally witnessed any cases, but I've heard of it.
I knew a couple like that,
Okay.
but I
Yeah.
had no idea what was going on, right?
Right. Yeah.
Until he finally left. But I had no idea. By looking at them, they just seem normal.
Okay.
Uh,
Yeah.
so so don't discard anybody. How should we document our findings to protect both the patients and ourselves?
Well, you want to make sure you write down all of your observations in the chart, whatever, and as specifically and as detailed as possible. Now, when you are released in Pennsylvania, and I'm pretty sure it'd probably be like this, if I would imagine every state, if you are making a report as a mandated reporter, you are protected by law because you are
Yeah.
basically trying to protect somebody else. So there can't really be a reprisal against you. Now, the only caveat is as long as you're not doing it maliciously to somebody. So, I mean, is that you're trying to get back at somebody by making a report like this. But no, I mean, you are protected because you are making a report to try to protect somebody who cannot protect themselves or who you suspect is being abused or neglected. And you're doing it in good faith. So you can go ahead and report, and there are no legal repercussions against you as long as you're doing so in good faith.
Because I imagine that some dental professionals might feel afraid of making a mistake or facing legal backlash because of
Correct.
it. So,
Yep.
how do you think that they should overcome that fear?
Well, that's a tough fear to overcome. Not necessarily the legal fear because you're protected by law.
Yeah.
But there are other things that come into play. For example, if this involves patients of yours, of course you're going to get potentially a bad Google review, or they're going to tell their friends, oh, this dentist is terrible. No, this practice is terrible. You don't ever go back to that practice again because they're very
Yeah.
evil and they're bad people who don't like us and things along those lines. And actually, that's what I faced. So, actually, when my practice partner made the report in his case, it really didn't matter to us that that family did not end up coming to us because they never came to us before anyway, except for to bring these two children who they brought in. And then we saw that the one was definitely being abused, and the other one said he had witnessed the abuse and that there had been abuse prior. Like other siblings who are older actually left the state. They got married and left and went to Indiana. Those family members had been abused by the father too. So there was a whole bunch of abuse going on in that family. And in my case was the, hey, I'm going to give you a really horrible Google review, and I'm going to tell all the members of my church, this is a Mennonite family, how bad you guys are and how you guys are evil. And so this person said this to our front desk staff, like directly to our front desk staff. And she went ahead and did do a negative Google review. So she carried through with that, which okay. The case ended up being resolved. Now the child fortunately is getting care that he needs. So the child is getting the care that he needs and is getting fillings done. And these were things that had sat for 8, 9 months or so and not been taken care of.
Yeah. It's important because if we don't advocate for our patients that don't have a voice,
Yeah,
I mean, who is going to do it?
correct.
You know, I mean, we have to. So that is great that you did that, that you guys did that.
The patient needed the care. I mean, it was, I mean, it had 10 cavities the first time he came in, and the mother said, "Well, let's try natural remedies." The next time he came in, he had 12 cavities. Like, your natural remedies did not work. You need to see a pediatric dentist. After several attempts, if I called the pediatric dental office saying, "Hey, did they ever contact you?" No, no. Twice I asked. My dental assistant then called the mom. Hey, did you schedule with a pediatric dentist? No. Did you schedule with any dentist? No. At that point, are you going to do anything? Didn't really give an answer. At that point, there's no plan to do anything, so you have to intervene.
For sure. What else are you going to do? That is insane. So besides documentation, and I cannot stress this enough, guys, document for so many reasons, right? Because if you have to go to court and not only with this, but with everything that you do, is so important because that's the first thing that they're going to ask from us is the
Yep.
documentation. Taking pictures, maybe, right?
That can be, in fact, I'll tell you, they'll ask for records, they'll ask for copies of x-rays. So in my case, they subpoenaed me to testify to the court. I was lucky I didn't have to be in person. I could do it by phone. But I mean, nevertheless, I was subpoenaed to testify in this case.
And this is for neglect. If it was abuse, definitely if you have a cell phone or something, take pictures of it.
Yeah, I mean, you're going to want to have photos because that
Proof
way they can see it. I mean, writing in the chart is one thing, but it's much better to have actual pictures in order to help document the case.
to back you up. Whoever it is, try to get that person by itself and ask questions.
Yeah, yeah,
Right.
you're definitely going to want to say, "Hey, this is a safe place. If there's something going on, you can speak up, and it's okay." You can certainly do that.
Where can they find information about this? And I guess that everybody in the dental office, dental
Right.
assistants too, are they Monday?
Everybody is. So what I would say is, say, the Pennsylvania Dental Association or Florida Dental Association or wherever you happen to be should have readily available information on this. Yeah, and so you could look up those state dental associations to find information on it. It should be very, very easy to locate.
Maybe have information in your office.
Or you can find it and print it out and have it ready to go. So that way you have something physical that people can read, not only just looking up on the computer, but actually have some a printout for that. Yeah, absolutely.
Right. Have office meetings,
Yep,
talk about it,
absolutely.
and have like a game plan. So if I see this, of course, I'm going to document and talk to the patient. But also, my next thing would be go to my dentist, inform him I suspect this, take a look.
Yeah,
What do you think? Because I think that one of the problem with us is that you cannot second guess yourself, right? Like, okay, am I seeing what I'm seeing, or am I just imagining things? Am I making this bigger than it is? And then retribution from your patients, like
right. Yeah,
nobody wants to get out of the office and the tires on your car, they're all slashed.
yeah.
It depends on the patient. Do you want to add anything, doctor? Something that people should know?
Well, I mean, even if you're not 100% sure, you can report it. Because the danger with not reporting something is that what happens if something happens to that person? Life could be in danger. Health could be in danger. Long-term mental health could be in danger. So it's always maybe better to err to the side of reporting than not. Now, you're probably not going to encounter many cases of this, and I hope people don't encounter many cases of this.
Yeah,
I hope that it only happens to be like a once in a career or never really in a career. I'm hoping I never have to see anything or have to do anything like this again, of course, because you just don't want to see people that are suffering. You want to make sure everybody's well taken care of. But it's always better to report than not to.
absolutely. Because it's true, like you say, if something will happen to that patient and you find out later, then how can you sleep at night at the end of the day?
Yeah,
So
correct.
it's better to report that to make a mistake and not report it. Totally agree with you. So do you have anything else to add?
No, I don't. But I want to say thank you so much for having me. I appreciate it, and it's always good to see you online.
We see a lot of each other. So what advice would you give to a dental professional who might face this for the first time?
Like we've discussed in the past, document very, very well. That's really, really important. Make sure you get all of the details, that chart notes are well organized and well written. Make sure you contact the agency and they will follow up. I mean, they're going to be pretty thorough about it. They'll give you a call back. You'll get emails and then they're going to probably call you a couple of times as follow-up questions. But yeah, just make sure you have, radiographs, pictures if you need them, document chart notes documented. If you see physical signs of abuse, try to record where on the body in addition to taking pictures. Maybe if you can get a timeline from the patient, when these things were occurring, how often in the past, what exactly happened, what triggered this, the things along those lines. As much detail as you can get.
Yeah.
That's what I'd recommend getting, if you're encountering this, for the first time or any time.
Right. And how can we better educate and prepare the dental community to fulfill this responsibility with confidence?
So, I mean, again, in many states, this is continuing education that's mandatory that you have to take. We take child abuse course every 2 years. For example, in Pennsylvania, University of Pittsburgh offers a free course. It's a 3-hour course. So you take it every licensing cycle. There are other courses that are out there as well, usually for a fee, which okay, it's fine. So you go and you can hear people lecturing and giving information about this topic, about abuse and neglect and how to identify these sorts of things. So you want to be prepared by going to these courses, listening, and then just make sure you're looking, observing. Look for changes in people. Sometimes somebody who's a certain go always a certain way, maybe happy, chipper, whatever, all of a sudden seems really, really different. That's kind of a red flag where you want to say, okay, time out. What's going on here? Because usually you're a happy go lucky person. And today you're looking anything but. Everybody has bad days. Maybe you identify something that's more than just a bad day. Maybe it's something deeper than that. So always be paying attention.
For sure. So guys, try to educate yourself. Take your courses. Go online. There is tons of information. Make sure that your office is up to date with these things, and that they have the information there for you to be able to read, discuss it during meetings. Because God forbid, I don't believe you will never have to encounter this, but these things happens.
Oh, it's out there. It's real. I can tell you that.
This has been such an important conversation. Abuse and neglect can leave scars beyond the oral cavity. And as dental professionals, we are in a unique position to notice early signs and act. And
Mm.
explain bruises, injuries inside the mouth, or patterns of neglect. We have the responsibility as a Monday reporters to act.
Yep. Yes, we do.
So thank you, Dr. Alessandro, for
All right.
sharing your experience and guidance. And thank you to everyone listening. Remember, protecting our patients means looking beyond the teeth and seeing the whole person. Thank you so much, Doctor. I will see
All right.
you next time in Real Talk Beyond the Dental Chair. And don't forget to subscribe if you guys want to see more episodes.
All
Bye
right.
bye now.
All right. Bye bye.
Thank you.